I'm Sherry Boschert reporting at the annual meeting of the Society of Hospital Medicine. Dr. Rick Hilger reported on a pilot study that created a hospital care plan for 28 high-risk patients and saved that hospital more than $500,000 in just a 2-month period.
The status quo for how we take care of these high-risk patients is it's not sustainable. It's not sustainable for individual patients, and it's not sustainable for society. We started this pilot about a year ago to try to better coordinate the care of our highest risk patients. There's lots of different definitions for high risk patients. What we focused on were 3 types of patients. One, patients with long-standing narcotic-seeking behavior. Number 2, patients with behavioral health diagnoses, but especially borderline personality disorder or borderline traits. And 3, patients with just a long history of medical noncompliance leading to high ED visit rates and high readmission rates. So we pulled together leaders from multiple different departments, including hospital medicine, emergency department, primary care, risk management, to create care plans. So the care plans were put into the computer system so that whether the patient was in clinic, in the emergency department, or in the hospital, that provider received an alert that this patient had a specialized care plan. With one click, they can go to this care plan and within 30 seconds get vital information that they need to give the safest, highest quality care for this high-risk patient. We looked at number of ED visits and admissions 2 months prior to care plans and then 2 months after the care plan was implemented. When looking at, we have data from 28 patients. Over a 2-month period, we showed a 65% reduction in ED visits and hospital admissions. And our finance department says that ideally in a closed system, that would be a cost savings to society of over $500,000 just for 28 patients and just over a 2-month period. So what's really exciting about this, we didn't want to wait for the perfect system to get started. We know a lot more than we did 12 months ago, but we're learning something new every day. I think what's exciting as this gets more and more publicity nationally is that I think more and more institutions will get started, and maybe a year from now, 5 years from now, 10 years from now, we will have a more integrated system, because we know that some of these high-risk patients jump from hospital to hospital. And so what we want to do up in Minnesota is take what we've learned at our institution and start having conversations with other hospitals in town to see if we can start coordinating care within our community.
Reporting for Global Medical News Network, I'm Sherry Boschert.